I do believe that technology helps shrink the distance between care and the individual. It's the last mile that technology so far has not been able to cover. In our most dire conditions, right, where we're in the most painful situation, most of us still crave for the human care. But that human care can be enhanced by the information.
In this episode, Anita Ballaney, founder of MyHealthQ, discusses the future of healthcare delivery models and the need for modernized payment systems to improve efficiency and reduce costs.
Hi, everybody, and welcome to this episode of the Leadership Exchange. I'm so excited to be here today with Anita Ballaney. My name is Tracy, by the way. You can follow me on Twitter at LadyLeet or on LinkedIn at Tracy S. Lee. And Anita, welcome to the show.
Thank you. Thank you, Tracy, for having me. Hi, everybody. Good to meet you.
Yes. Oh my gosh. I'm so excited to talk about this topic today with you. I know you are so incredibly passionate about so many things related to healthcare and technology. And I just always love having amazing conversations with you. So thank you for being here.
Thank you.
So, I think in the wide swath of things that you are excited about, I know one of the things that you're excited about is kind of challenging the status quo. So, if we talk about care delivery models changing, I'd love to hear from your perspective how the models are changing and what your perspective is on what needs to change in order to make those models to be effective and successful.
That's a great question. So in order to talk about what's changing, I think we do need to spend 30 seconds on how it has been, how it got, where it is today. So if you think about what I refer to as the orthodoxies of healthcare, right? The current model of healthcare is so deeply rooted in things that were happening almost 100 or 150 years ago. So think about it. 150 years ago, care was delivered in medical homes, right? A lot of it was, there was a care setting, people went there. A lot of it was faith-based, and it was driven by local communities. Fast forward 150 years as modern medicine evolved, and I must kind of mention two discoveries that really changed the care delivery models. One was the discovery of anesthesia, and the other was the discovery of antibiotics. And following that, there were a number of medical discoveries that allowed care to move away from the medical homes. Care was delivered at home. We had prescription drugs. We had a whole number of things. And fast forward today, we've got care being delivered through telemedicine, through our apps, through a number of new models, right? But what has not changed is the way we pay for care, right? The payment for care, by the way, if folks, may be interested in knowing that the original health plan model was also an innovation of a physician, right? And that was still based on that original model of that inpatient or indemnity or the facility setting care, right? As new discoveries happened and, people needed to understand the risk, all of that pricing and costing just kept getting tagged on. And there were codes being created, there were things. And so today our healthcare model, while it's, the care delivery and the number of conditions that can be cared for have increased, the payment model, which is still kind of confined to that third-party payment model, is still stuck in that legacy model, and everything is a bolt-on, and all it does is add administrative costs, etc. Right? So going back to your question about how the care delivery models have changed and how technology has come fast forward and what's holding us back, I can get care, a number of people will say, I can get care where I want, right? Through the use of a phone, through a use of telemedicine. There is enough technology that, we've got these robotic arms that can actually do surgery thousands of miles away, right? So these platforms have emerged, but our payment models keep holding us back, right? It just increases the cost of care for everybody, right? So does that answer your question? Like, does that go back to like how these models are evolving and what's holding us back, and how do we go where we want to go?
Yes. I mean, do you have recommendations or ideas, or what is being worked on to try to help these models be a little bit more successful?
So I think this is where I do believe AI can play a role and help us break away from the what I call the shackles of coding, right? So if you think of coding, it's like, hey, everyone has to manually enter a certain code. But given AI and the large language models and the intelligence that we're putting in, right? Instead of AI coming up with a code and making it hey, here's the way the billing goes, it could very well be, here's the full package, right? Or here's the full bundle, and it gets priced differently, right? So as opposed to, building codes over each other. And then, I think coding systems have created the worst inefficiencies in our healthcare systems. AI could help us eliminate that. Even today, a number of companies that are working on payment accuracy models or payment accuracy algorithms, they're still bound to that old coding logic or the claims systems, right? What if using AI, understanding the diagnosis, the observations that physicians write, we can figure out what the pricing or the cost of that care should be. It might just bring the cost down, right? Or what if we never had the third-party payment? What if we never had to go through that administrative burden of going through an insurer? The other way modern technology or AI can help is, one of the things that insurance products do is evaluate risk, right? But with so much of predictive models, with so much information available, does that prediction of health, the risk of health, be more predictable, right? Are we being able to eliminate the non-predictability, or are we being able to create more predictability in the care that's needed? And therefore, do we really need such expensive models, right? Can that bring the overall cost down? So those are some things where I think technologies like AI, the algorithms, large language models can help, right? Let's just rethink the way we think about the entire care pathway. And can we bring things together, right? If you think about, if I go back to that, hey, first it was inpatient care, then pharmacy evolved, and then the PBMs evolved. Now there's outpatient, and there's a whole bunch of codes that come about it. But what if we were able to step back and rethink the clinical pathway that says, yes, there's so much of inpatient stay, there's so much of outpatient, there's so much of physical therapy, there's so much of medication. And by the way, here's the rest of it that gets taken care of at home. And you have home service. And now that's your pathway that you want to price. Right? Now you can completely bring the cost down. That's a way of thinking. I don't know if people are thinking about it, but that's one way to use technology to rethink that entire pathway and redesign the care and make it more accessible.
And what would, insurers or doctors say? Because I know that, if you go to a doctor's office, the doctor is typically trying to get as many codes in there as possible because then they get paid more. So what do you say to that?
So what if the payer, and this is where we say, hey, let's eliminate that third party. What if that equation is directly between the patient and their provider or the doctor, right? For all. Now, I am not saying that there's no role for a health insurer, right? Catastrophic conditions, there are certain things that will require health insurance coverage. And let them focus on that, right? Let those pathways be aligned, and let the payers and the providers work together on those conditions, right? But for something that is, you and I can take care of through simple protocols, through simple things and prevent certain things from going to that egregious state, then why not do that? Conditions like diabetes, while, there's a genetic component to it, but lifestyle impacts, right? Why don't we control that ourselves and keep the cost down? But conditions like cancer, conditions like other neurodegenerative conditions, which people don't have control over, lifestyle is not something that impacts those. It's inherent. Let's solve for that in a partnership. So I know state Medicaid agencies are working to figure that out and solve for it together. But you're absolutely right. Our current model has created these incentives where the providers are always trying to increase the codes that they can bill. And so that's that revenue cycle management where they're trying to increase the number of codes. And then payers are investing in payment accuracy and payment integrity where they're trying to bring everything out down. And then now they have these value-based care models, which in my mind, it's only adding administrative burden to our ecosystem. So, if somebody did the math on that unit cost of care may be coming down, but the portion of administrative cost that's going up does not allow for the total cost of care to come down. There are many other factors, risk pooling and, how we pay and how we segment our markets, all of that plays. But that does require an overall revolutionary change in our healthcare ecosystem and the way that we think about it. Will providers see a decrease in revenue and will payers see a decrease in their premium revenues? Maybe. But, there's an example that I read about somewhere. There are still many conditions that are not covered by insurance and their costs have come down. The most common example given is the LASIK surgery. Right? That's a procedure that's not covered by health insurance. And if you look at the price of that procedure over the last 10, 15 years, it has come down. And so there is a profit pool somewhere. It's just not in the insurance and in the insurance space. But it doesn't mean if you think from a business perspective, there is some segment of the business that will definitely, gain that profit pool, right? It's a matter of how companies manage their portfolios.
And then in terms of technology, so if we think about technology as we have it, how do you think technology is going to potentially solve some of these problems?
So, first of all, technology in terms of, the data that we are collecting and the whole analytics behind it and that engagement and the information that we can share with people and the population, that's a big play, right? Technology increases awareness. Technology increases reach. Technology increases speed. I do believe that technology helps shrink the distance between care and the individual. It's the last mile that technology so far has not been able to cover. So if you think about what I mean by that last mile, and people have challenged me on this, and I'm open to being, open to changing my mind about this. But in our most dire conditions, right, where we're in the most painful situation, most of us still crave for the human care. But that human care can be enhanced by the information, right? If it's a family caregiver, then just preparing the family caregiver to take care of their loved ones, that's where technology can help. There is a model, this is actually a good example. There's a company called Healthy Med. Again, I haven't spoken to them, I've read about them. They are able to provide care within the home setting through the normal television. So they provide their members with a smart TV. And as an individual, if I'm homebound, I can be watching programs on the TV, but when it's time for me to take my medication, a reminder pops up. And you won't be able to continue to watch your game that you're watching unless you go take care of things, or unless if I'm supposed to go exercise or do something, then it interjects, right? Those are really creative uses of technology that would absolutely help.
Makes a lot of assumptions, though, on people watching TV.
But a number of people do, right? I mean,
Mm-hmm.
it depends on you're right. You definitely have to be focused on the target population, or who's the population that we're talking about. Similarly, there was an innovation that we saw at one of the age tech conferences, and I think this was an innovation that won the prize, which is there is a device that an individual can wear on their finger and be able to turn lights on and off, right? So the part about technology that I'm saying that is the next chapter, or where we are headed, like in addition to just providing information, is that physical action, that physical activity that technology can help with, right? Being able to do certain things, being able to control devices within your house that can help you bring medicines to yourself, to you, or be able to, initiate your microwave to heat your food, or your refrigerators, right? And that is the kind of things that technology and digital health will be able to do. So I think I do see a future where this is bound to happen.
Yes. And kind of speaking about kind of the where patients are getting care is changing. I know telemedicine is something that's definitely talked about in the kind of digital health sector. So telemedicine has kind of become this cornerstone of digital healthcare. I mean, especially post-pandemic, right? I love the fact that I can just call up a doctor and get something prescribed. But what are kind of some of the next innovations in telemedicine that will further integrate into mainstream healthcare? How do we make it an actual sustainable model for care delivery? What does it take to make that actually effective?
A couple of things. On the most simplistic level, if we integrate the telemedicine consult in the overall care pathway, so and today we haven't been able to do, but I think people are starting to talk about this. I'm not saying that I'm saying anything new. People are talking about this, that, day one, I could go and see my PCP in his or her office. Day 10, I have symptoms. I, urgently need to see a doctor. My PCP's appointment is not available. There are companies that will provide a PCP who can consult and give me some information. But that visit being incorporated in my PCP's records and then a follow-up, those are some examples. Those are simple things where, and I kind of use that process mindset, right? That connectivity is starting to happen. That needs to happen, right? An extension of that could be helping with physical therapy. Robotics can help there. There have been examples where, now this is kind of a little bit of a combination of telemedicine and virtual care. This is a combination where this was happening 10, 15 years ago, where surgeries in the war zone were being performed by experts who were sitting in, within the United States geographic boundaries, but were being able to perform surgery some places. That still requires a surgical setting, right? But the point is, and this was something we were even talking about 10 years ago in the New York program, where we were thinking about, how to provide care for people with neurodegenerative conditions, where the experts are able to consult to a remote PCP, right? So starting to create those hub and spoke models for care through telemedicine, where it's either a consult or maybe guidance in surgery, or maybe guidance in physical therapy, or being able to guide physical therapy. It's possible. It is very possible to be able to do that. It's not become mainstream yet, because the mainstream still gets bogged down by the question, who will pay for this? And we go back to that, hey, we are shackled by our third-party payment model.
Yeah. But, again, I kind of always, I guess as a builder, I'm always thinking, okay, well, what do we have to build? What do we have to build to make this possible? So what do you think needs to happen? I mean, how can how can people kind of leading innovation teams in large, whether it's, whether it's on the payer side, whether it's on the provider side, or people building for those people, what do they need to do to move us closer to this world where healthcare is more accessible, this world where healthcare is more cost effective?
So I think we definitely need to continue to promote innovation. And I am not a huge believer of subsidizing innovation. Today, majority of the innovation is funded through government funding, right? So I think encouraging innovators is one. This will be the controversial part of what I'm about to say, right? I do believe some regulation needs to come down. Now, at the same time, the reason for regulation has been quality, right? So I think one of the reasons why we have this need for someone in between is to ensure that these quality of solutions is up to the highest standards, right? So I think innovation, I don't think we lack the products, or I don't think we lack the innovation. I think somebody in in the session on Friday mentioned that there might be $500 million worth of solutions, digital health, that the consumer may be able to buy themselves, right? The thing that needs to ensure that is viable, feasible, and the cost keeps coming down is making sure that the quality of the solutions, the efficacy, the effectiveness is maintained. I think that is something that we must be mindful of. But other than that, I don't think we have many barriers, right? Again, we talk about interoperability as a barrier. Interoperability is not a technology barrier. It's a human barrier because the contracts don't exist, right? If you and I agree, and I don't mean you, Tracy, and me, Anita, but if two people agree to work with each other, they will open up their systems to each other, right? So that openness, that trust, if we increase that, then and hold ourselves to a higher standard, hold ourselves to that accountability, then things will happen. So I don't think, I think regulation does become one of our bigger barriers, ensuring quality, and then kind of holding ourselves accountable. And this is where I get a little bit philosophical, right? I think that goes a much longer way than trying to force certain things. Right? The minute we try to force quality through regulatory requirements, it will only increase our administrative cost.
It's funny because it kind of circles back to, hey, you know what? Technology does solve a lot of things, but it really is people problems we're solving at the end of the day.
It is essentially people problems that we are solving at the end of the day. Technology will do, and I am convinced it can do whatever we want it to do. It most certainly can. And I'm very impressed. On Friday, there was a gentleman who has created this app that was actually able to understand my accent and interact with me and summarize the entire conversation I had with this app.
Oh, that's really cool.
It is very cool. And I'm going to give a shout out to this guy. His name is Bradley Dick. I think you may know him. And so you can do all of this.
Yeah.
The issue is not technology. The issue is not creativity. The issue is man-made barriers.
That's definitely a lesson we all need to continue to understand. But I wanted to take a quick shout out to thank our sponsor, This Thought Labs. This Thought is a consultancy dedicated to guiding companies through their modernization and transformation journeys. I think, though, a lot of times we are brought in to solve technology problems, but a lot of times we spend a lot of time on the people problems and solving people within technology teams. So we do specialize in replatforming, launching new initiatives. And we love taking just true ownership of engineering projects as well. We love helping teams that have projects that may have missed deadlines. So you can check us out. Check us out at thisdot.co. That's thisdot.co. And now back to our show. And Anita, I just wanted to say a quick thank you so much. Thank you so much for spending some time with me and shedding some light onto what is needed to make this change. I feel like you always have such big, grand visions of, you know, what needs to happen. And I'm just like, well, where do I start?
I'll leave you with a couple of thoughts. My motto in life is being human is our biggest strength. And then thank you to everything you are doing, bringing people together and having these conversations and increasing this awareness and supporting people like me. Is much appreciated. I think just by having these conversations, we might be able to do more.
Absolutely.
So I think
really
this is great.
Just about having the conversations, because then it filters into people's, you know, shower thoughts and thoughts right before you go to bed, and thinking about, okay, you know what, we have people barriers now. What people barriers do I have within my organization? What do we need to make a change? Does this really need to exist within life? And you know, how can somebody just make that small change and do something about it? Because it really is just those tiny, small little steps that really make that impact overall.
Absolutely. And to your point, you know, you just asked that question, what can I do differently? Right? It's those questions. I am a huge fan of asking questions and creating a future where the mind is without fear. Don't be afraid to ask that simple question. If you have that question in your mind, I guarantee you there are at least 10 other people who have the same question.
Yes, that is a very good reminder. Well, thank you again, Anita. Where can we find you online?
You can find me on LinkedIn, Anita Ballaney, and my company's name is MyHealthQ.com.
Perfect.
Precisely named for asking questions. People have questions, and those questions are important to them, and people are important to me. So I'm welcome to take any questions and help anyone.
Well, amazing. Thank you so much again. Thanks everyone for listening, and we'll catch you next time on the Leadership Exchange.
Thank you so much. Thank you, everyone. Have a great day.